If you're over 60, chances are you take several medications every single day. Some people take pills for blood pressure, others for cholesterol, arthritis, or sleep. Maybe you have a small stack of medications on your nightstand or a drawer full of pill bottles in the kitchen. If this sounds familiar, you're not alone. In fact, millions of older adults in the United States are in exactly the same situation. Most people assume that if a pill is prescribed by their doctor or bought over the counter, it's perfectly safe. But here's the truth. Most medication problems don't come from a single pill. They come from mixing the wrong ones together. Think about it. Your body at 65 or 70 isn't the same as it was at 40. Your liver, kidneys, heart, and even your stomach process drugs differently now. What once felt safe may now carry hidden risks. Today, I want to calmly walk you through 3 common medication combinations that can increase health risks in older adults. These are combinations many people take every day without realizing the danger. And before we begin, let me reassure you, this video is not meant to scare you. If you recognize any of your medications here, it does not mean something bad will happen. It simply means you're learning information that many people are never told. By the end of this video, you'll not only know the 3 risky combinations, but also practical steps you can take immediately to protect yourself. And I promise we'll do it in a calm, easy-to-understand way. Legal medical disclaimer. This video is for educational purposes only. It is not medical advice. Do not stop or change any medication without speaking to your doctor or pharmacist. I'm simply sharing information to help you make informed, safe decisions and to start conversations with your healthcare providers. Let's start with one of the most common and often overlooked combinations. Many of us take over-the-counter pain relievers without a second thought. Maybe it's for arthritis, back pain, joint pain, or even just a headache. Common options include ibuprofen, known as Advil or Motrin, naproxen, Aleve. They're available at any pharmacy, and millions of Americans use them daily. But here's the catch. While these medications are generally safe for short-term use in healthy adults, they can raise blood pressure and reduce the effectiveness of medications that are supposed to control your blood pressure. Many older adults take medications like lisinopril, amlodipine, losartan. These are life-saving medicines that help prevent heart attacks and strokes. But if you regularly combine them with NSAID pain relievers, your blood pressure might stay higher than expected, even if you take your medications on schedule. Imagine this scenario. Every morning, you take your blood pressure pill faithfully. You check your blood pressure at home, and it's still higher than your doctor wants. You might think, maybe it's stress. Maybe I ate too much salt yesterday. But the hidden culprit could be your over-the-counter pain reliever that you've been taking for weeks. Why this matters? Over time, high blood pressure increases strain on the heart, damages blood vessels, and can elevate your risk of stroke or kidney problems. It's a slow, silent process. You might not feel anything until a serious issue occurs. Now, a calm reassurance. This doesn't mean you can never take these medications. Many people use them safely, especially for short-term pain relief. The key is awareness. Regular or long-term use should always be reviewed by your doctor or pharmacist. One tip many people don't realize: sometimes alternating acetaminophen, Tylenol, with NSAIDs or spacing the doses can reduce the impact on blood pressure. But always discuss this with your healthcare provider before trying anything.
The second combination is particularly important for seniors. Blood thinners are prescribed to prevent blood clots, heart attacks, and strokes. Millions of older Americans rely on them daily. Common options include warfarin, Eliquis, Xarelto, Plavix, even daily low-dose aspirin. Now here's the tricky part. Combine blood thinners with NSAID pain relievers like ibuprofen or naproxen, and the risk of internal bleeding increases significantly. And the scariest part? Internal bleeding can begin silently. Many people don't notice anything at first. You might feel fine, maybe just a little more tired than usual, but the bleeding is happening inside your body. Warning signs to watch for: unusual fatigue, dizziness, dark or black stools, weakness without any clear reason. Calm tone reminder: this doesn't happen to everyone, but the risk increases with age, especially when multiple medications are involved. The best defense is knowledge and vigilance. Keep a list of every medication you take and ask your pharmacist or doctor to review it periodically. Many people underestimate the power of their pharmacist. In the United States, pharmacists are highly trained professionals, often underused, and can be an excellent resource for checking drug interactions.
The third combination is one that many seniors overlook: sleep medications combined with alcohol or sedating over-the-counter medications. Common examples include Ambien, Xanax, or Ativan, over-the-counter sleep aids containing diphenhydramine, Benadryl, or Tylenol PM. It may seem harmless to have a nightcap or to take a sleeping pill for a restless night, but here's the problem. Even small amounts of alcohol or other sedating medications can multiply the effects of sleep medications in older adults. This can lead to confusion, poor balance, falls, and slowed breathing. Falls are one of the leading causes of injury and hospitalization for seniors. In fact, many emergency room visits in older adults are linked to this exact issue. Key line: what felt safe at 40 can be dangerous at 70. The body processes medications differently with age. Slower metabolism, reduced kidney function, and changes in brain chemistry all contribute to higher sensitivity. Practical tip: always read labels. Avoid mixing alcohol with prescription sleep or anxiety medications, and discuss alternatives with your doctor if you struggle with sleep.
Now that we've covered the three major medication combinations, what can you do today to protect yourself? Here are 4 practical steps. 1. Write down every medication you take, including prescription, over-the-counter, vitamins, and supplements. Many seniors forget to mention herbal supplements, but these can interact with prescription medications. 2. Bring that list to your doctor or pharmacist. Ask them to review potential interactions. Don't be shy. This is your health, and your questions are valid. 3. Never assume over-the-counter means risk-free. Just because something is sold without a prescription doesn't mean it's harmless. 4. Ask one simple question: could any of these interact with each other? A 60-second conversation can prevent a serious health problem. And remember, your pharmacist is one of the most underused healthcare professionals in the United States. They can catch interactions, advise on timing and dosage, and sometimes even suggest safer alternatives. If this video helped you, please share it with someone you care about, a spouse, friend, or family member. Many seniors are never told these things, and one calm conversation can prevent a serious health emergency. Subscribe to this channel for clear, honest guidance about staying healthy and safe as we age. We focus on information you can trust, presented in a calm, easy-to-understand way. Thank you for watching, and take care of yourself. Your health is the most important investment you'll ever make.